than over-the-counter Narcan. Even in the small town of Cambridge, Ohio, 1/3 of their calls are mental health calls as well. Since the over-the-counter Narcan has become available, they have seen no increase or decrease in drug-related calls, but they have seen a small increase in recovery. So that is a good thing that's come out of this. And another thing he said was there's some important information about Narcan that they're not putting out. Multiple doses are safe, and sometimes they are necessary. So only having one nasal spray around may not be enough. And the use of the Narcan is for a drug overdose with respiratory compromise. That means shallow breathing. And if they're not breathing, you have to breathe for them or the Narcan will not work. They recommend a bag valve mask, which I found online at the public safety store for about $17. The reason why you're needing more than one Narcan spray is in the 2000s, they began mixing fentanyl and carfentanil in the street drugs. Carfentanil is 100 times stronger than fentanyl and 10,000 times stronger than morphine, and it is Narcan resistant. And as far as the way that we are handling drug addiction, they're looking at this completely backwards. The drug industry is a business. The war on drugs has been being fought backwards. They're going after the suppliers too much and not putting enough focus on the demand. Start giving the proper rehab for the drug addicts. By putting too much focus on taking out the supply, it leaves the demand high and increases the price of the street drugs. They start putting fentanyl in it to make things more addictive, causing more overdoses. Michigan's drug rehab is currently only about 28 to 32 days, and it's a maximum of 2 months. Like a lot of other states, they still use Suboxone on discharge from opioid addiction and heroin addiction. And the problem with that is a lot of the patients that come out on Suboxone, they take that Suboxone and trade it on the street for the drugs that they do want. So how do we fix this? We need longer, more comprehensive drug rehabilitation programs and rehabilitation instead of incarceration. These rehabilitation programs need to include the dual diagnosis. They need to include the mental health diagnosis with the drug addiction. They need to teach these patients coping skills. They need to provide services like dialectical behavioral therapy, cognitive behavioral therapy, acceptance commitment therapy, trauma education. A new one that I've heard of is eye movement desensitization and reprocessing. That's a mouthful. Information on PTSD. One thing that we did while we were in the VA was called a Wellness Recovery Action Plan, or it's called what's known as a crisis plan. And it needs to be in depth to make sure that the patients know the signs and symptoms of when they're getting bad and when they need to reach out for help instead of letting it escalate into a crisis situation. And that will help them become more productive members of society and give them a more fulfilling life. If you'd like to find out more information about our organization, please look us up on Facebook. Thank you.